The ethos of partnership in therapy. The ethos of partnership in therapy represents a paradigm shift in the therapeutic landscape, advocating for a collaborative and egalitarian relationship between therapist and client. This approach challenges the traditional hierarchical model, which often positions the therapist as the expert and the client as the passive recipient of knowledge. The partnership ethos is rooted in the belief that both therapist and client bring unique expertise to the therapeutic process, the therapist with their professional knowledge and the client with their lived experience, personal insights, and intrinsic wisdom. This dynamic interplay fosters a therapeutic environment where healing is a mutual endeavor. Pause. The theoretical underpinning of this approach draws from humanistic and existential traditions, which emphasize the inherent worth and agency of individuals. Carl Rogers' person-centered therapy, for instance, highlights the importance of empathy, congruence, and unconditional positive regard, which are foundational to a partnership-oriented approach. By fostering an atmosphere of acceptance and understanding, therapists can empower clients to explore their inner worlds, leading to greater self-awareness and personal growth. However, the partnership ethos extends beyond mere theoretical alignment. It is deeply practical. Therapists who embody this ethos practice active listening, demonstrating genuine curiosity and respect for the client's perspective. They engage in reflective dialogue, where both parties contribute to the construction of meaning and the co-development of therapeutic goals. This shared decision-making process is crucial as it respects the autonomy of the client and encourages their active participation in the healing journey. This is crucial. Contrasting perspectives highlight the tension between traditional and partnership-based approaches. The medical model, for example, can be seen as antithetical to the partnership ethos, as it often prioritizes diagnostic labels and prescriptive interventions over collaborative exploration. Critics argue that this model risks objectifying clients, reducing them to a set of symptoms rather than viewing them as whole persons. Yet, proponents of the medical model cite its efficacy in providing structure and clarity in treatment protocols, especially in cases of severe mental illness where immediate intervention is necessary. Pause. In practice, embracing a partnership ethos requires a nuanced understanding of power dynamics. Therapists must remain vigilant against the subtle ways that power imbalances can manifest, even in a partnership-oriented framework. This vigilance is supported by ongoing training and self-reflection, enabling therapists to recognize their biases and assumptions. Furthermore, incorporating feedback mechanisms such as regular check-ins or client satisfaction surveys can help maintain transparency and accountability in the therapeutic relationship. Emerging frameworks, such as collaborative therapy, further expand on the partnership ethos. Rooted in social constructionism, this approach views therapy as a dialogical process where meanings and solutions are co-constructed through conversation. In this model, the focus is not on finding the right answer, but on exploring diverse perspectives and possibilities. This can be especially effective in multicultural settings, where acknowledging and valuing different cultural narratives is critical. Interdisciplinary insights further enrich this discourse. For example, narrative therapy, with its emphasis on storytelling and reauthoring one's narrative, aligns closely with the partnership ethos by privileging the client's voice and agency. Similarly, insights from relational psychoanalysis emphasize the co-construction of meaning and the mutual influence of therapist and client on each other, underscoring the dynamic, intersubjective nature of the therapeutic process. To illustrate the application of the partnership ethos, consider two case studies. The first involves a therapist working with a young adult client grappling with anxiety. Initially, the client expresses feeling overwhelmed by societal expectations and a perceived lack of control over their life. Adopting a partnership approach, the therapist engages the client in setting the agenda and identifying which aspects of their anxiety they wish to explore. Through this collaborative process, the client begins to articulate their values and aspirations, which had previously been overshadowed by external pressures. This empowerment leads to the development of personalized coping strategies, co-created with the therapist, which the client feels ownership over and is thus more committed to implementing. The second case study examines the use of partnership in a community mental health setting dealing with culturally diverse populations. Here, therapists work with clients from various ethnic backgrounds, each with distinct cultural understandings of mental health. By prioritizing cultural competence and humility, therapists invite clients to share their cultural narratives and incorporate these into the therapeutic process. This might involve recognizing traditional healing practices alongside conventional therapeutic techniques. In doing so, the partnership ethos facilitates a culturally sensitive dialogue, where therapy is adapted to fit the cultural context of the client, rather than the client having to conform to a predetermined therapeutic model. Pause. In conclusion, the ethos of partnership in therapy represents a profound commitment to egalitarianism and mutual respect in the therapeutic relationship. It challenges practitioners to move beyond conventional paradigms and embrace a more inclusive, dialogical approach that honors the client's voice and lived experience. This shift necessitates a continuous engagement with theoretical, practical, and ethical considerations, ensuring that therapy remains a responsive and dynamic process. By integrating cutting-edge frameworks, interdisciplinary insights, and culturally attuned practices, therapists can cultivate a truly collaborative environment that fosters genuine healing and transformation.